Hi everyone, and welcome to the third in the series of the LSN Ask the Expert videos. I'm Anita Wallace, Chair of the Lymphedema Support Network, and I'm delighted today to introduce you to the LSN's nurse advisor, Denise Hardy, who runs a very busy practice in Kendal, and she's very, very experienced. So I'm delighted that she's agreed to come on with us, and we'll get going on the questions. So Denise, the first question is actually probably quite a tricky one. Is there any way of getting the best care on the NHS, especially if the lymphedema is categorised as mild, but it certainly doesn't seem mild to me?
I think even if the lymphedema is mild, it's lymphedema, isn't it? And it makes a huge difference to quality of life, no matter whether it's mild, moderate or severe. So I think that's irrelevant in one way. Whatever the lymphedema, whatever state it is or extent it is, it needs treatment. You need to know how to manage it, because essentially lymphedema is a long-term condition. It's not going to go away. So if you don't know about it, you need to know how to manage it. So finding a clinic to help you to learn to manage it is really, really important. And therein lies the problem, I think, at the minute, Anita. I think, I've been in the field over 30 years now, and I sometimes wonder whether we're any further forward than we were way back then. There were a smattering of clinics, and there are loads more now, but it's still, I think, I don't know about you, I think it's a postcode lottery. I'm lucky here in the Lakes. I moved here in 2001, and although there was a small cancer service, there was nothing for those with a non-cancer diagnosis, and that's why I set up Kendal Lymphology, to do just that. I now see everybody with a cancer and a non-cancer diagnosis, because the other practitioners retired, and so I therefore took over. But if you go down to the South Coast, for example, there are areas there that have got nothing. There are areas further north that have got nothing. So it really is dependent on where you live, and that can be soul destroying if you're the one that's developed lymphedema or your child has developed lymphedema. So that's the problem at the minute. It's if you're lucky enough to live in an area where there is actually a clinic to help you. And I think, if there is, your GP will probably know about it and will therefore be happy to refer you to that clinic. If there isn't, then you have a bit of a problem. Where can you find one? And I think my first suggestion would be to go to you, the LSN, because you've got a fantastic directory of services that is, as far as I know, the most up to date. It's become a little bit more difficult since COVID, because a lot of our services were closed down because they were not deemed to be essential services, and a lot of the staff were redeployed to other things. So as it stands, there are a lot of clinics that were up and running, say just over a year ago, that are no longer running. So even though you've got a great directory, it's probably not now as up to date as it was a few months ago.
No, it isn't. We are going to be doing a review. We have heard of several clinics who will no longer be seeing non-cancer related, and that's a huge worry. So we're hoping to do a review within the next couple of months to bring the directory up to date. But I agree, the pandemic has caused all sorts of difficulties. And funding is such a struggle to get clinics up and running. But even if we did have the funding, there simply aren't enough practitioners to treat. And lots of practitioners are becoming worn out, and they're retiring early or just had enough of the battles to try and get funding. So it is a huge problem. And, we do sympathise with everyone, and rest assured we're doing all we can to try and maintain services for you.
Absolutely. For myself, I'm very much dependent on funding from two sources. For my cancer patients, we rely on funding from the hospital trust, which is a very separate funding to the funding I get for those with non-cancers, which comes from the clinical commissioning groups, the CCG. So every 2 years I've had to apply for more funding. I've had justify why we need a lymphedema clinic here. And that funding for the, I mean, I've, as I say, been open since 2001, and that funding has ebbed and flowed. It's never gone like that.
No.
Yet we've had more and more patients, more and more success, but the funding hasn't reflected that. And you may probably already be aware, but next year, the clinical commissioning groups, the CCGs are going. They're changing. They're becoming what I understand to be integrated care communities, which are very much related to your local population. So their aim is to look at services planned to serve the needs of that particular community. So my service is up in the air at the moment.
Yes.
There's such a wide area here in the Lake District. And if it goes down to just looking at little areas, I just don't know how we will be able to provide that service. Because we're so rural and so widespread. So I just don't know whether I'll still be functioning this time next year. I mean, other centres, it's not quite so bad. If you work, for example, within a hospice, they often have their own funding, which draws in the money that provides the lymphedema service, or a hospital. You're situated in a hospital, but those of us working in the community often rely on the CCG funding. So very difficult. And I just really don't know how that is going to pan out this time next year.
No. So I'm really sorry. So the first question, is really a little bit depressing for everyone. But maybe next year, when we've got, the new arrangements in place, that would be a time when we know the names of the people to target. That might be a time for the LSN to do some more work on trying to, improve the situation.
I have to say though, Anita, that going back all those years when I was setting up my clinic, the patient voice is incredible.
Absolutely. No, we are aware, and I do agree. So it's pointless doing anything right now because everything is in such a dreadful state of flux. So hopefully next year. Well, thank you, Den. Thank you.